Imagine a science fiction world where we plugged our bodies into a machine to clean them from toxins and refresh our system. What if I told you that that technology was already in place and has been since the early 1900s? I'm Dr. Adam Goodcoff, and today we're discussing dialysis, the magic eraser for your blood. Dialysis, in short, is an artificial filtration system for the blood used in times of kidney failure. The most common use for dialysis is actually not an emergency at all. I'm talking about the patient with long-standing kidney problems, chronic if you will. CKD, or chronic kidney disease, is the most common cause of dialysis use in the United States and across the world. Over 500,000 patients are on dialysis at any point in time here in the United States. How you get CKD or end-stage renal disease is a discussion for another video, but know that it's unfortunately very common. A modern dialysis machine has two components: the machine itself, which pumps the blood to and from the patient, and the dialysis circuit, which contains the hemodialyzer, or essentially the artificial kidney. First off, a patient requires access. An artery and vein are joined to create a high-flow system, and in others, an artificial tube can be placed to allow for this high-flow system needed. From here, the blood enters the dialyzer itself, where blood passes across a semi-permeable membrane. On the other side of that membrane is dialysate. Pressure is applied to ensure that the toxins can flow across the semi-permeable membrane. The membrane allows for ions and toxins to flow freely, but blood in the dialysate itself cannot actually pass. By changing the pressure in the system and increasing the pressure on the blood side of the semi-permeable membrane, extra quote-unquote water can be pushed out of the blood. This happens slowly over the course of an entire dialysis session, but you could remove multiple liters of excess fluid. Patients who have too much fluid removed often have severe cramping or very dangerously low blood pressures, so finding the right balance can be very challenging. Dialysis sessions as a whole are very stressful on the patient, and it's common to become extremely tired and even somnolent or sleepy after these sessions. A commercial dialysis session can run from 4 to 6 hours, and patients on dialysis need to be dialyzed roughly every other day. Patients choose either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. At this point, you can see dialysis really is no fun. This is the reason why many patients choose to be listed on a kidney transplant list. It's not all doom and gloom. Patients who receive a renal transplant are often given a new life. The kidney settles in and, with the help of medications in many cases, is able to begin filtering the blood with full efficiency, meaning the patient no longer needs dialysis. In short, to nearly 800,000 Americans with renal failure, dialysis is a second chance, and the mechanisms with which we clean the blood are both fascinating and extremely complex. What is far less complex is clicking the thumbs up button if you enjoyed today's video, and clicking on the subscribe button to have your health explained.